Assalamu alaikum wa rahmatullahi wa barakatuh, my esteemed viewers. I come back again for my daily COVID-19 update. Today, I think I will only have an hour because of it's a long day and I'm really, really tired. But I have to fulfill my promise. Yeah, today our topic is the lockdown, COVID-19, domestic violence, which is on the increase in the last few months and weeks. And as we all concentrate on the actual illness itself, COVID-19, but there is a significant amount of mainly women, not only always, but mainly women who are suffering, having to live with serious domestic violence issues. As usual, I will start this program with the numbers about COVID-19. As you remember, illness, this pandemic started in Wuhan, in Hubei provinces in China in December 2019. And since then, 2,530,000 people, 902, contracted the virus, that's COVID-19. And so far, 174,803 deaths. Alhamdulillah, 667,627 people recovered. And these numbers are going to be very, very significant in terms of treatment options. Right now, so far, there is no cure, even though chloroquine has been widely used. And all the research that confirm that chloroquine can actually work mainly from China. So, but still is being used across Europe widely now. So even though technically we can't say there is a cure, but hopefully that will be confirmed pretty soon. Okay, so I need to say something. Yeah, so these recovered people in their system, they are supposed to be um, an immunological cells that can help in the recovery of those who are suffering from the illness. Just yesterday, the UK government announced that they are asking people who recover to go and donate blood because if somebody who recovered from COVID-19, they are expected to have immunological cells that can um, help get rid of the viremia, that is the increase in virus in the blood of the sufferers. So it's a treatment option. It works like a vaccination, but more advanced like vaccination because what the vaccination does, it jolts, it helps your immune system by introducing false antigens, for example, in the case of COVID-19, it will introduce an antigen that will your body will see as COVID-19. They look similar in terms of their antigenicity, but in people who actually recover, these immune cells are already there. So basically, you are transferring immune cell from one person to another, or it's like transferring soldiers from one country to another to go and help. That's the literal meaning of it. So far, the number of people currently working with COVID-19 is 1,688,445. And out of that, 1,630,681 um, um, in mild conditions. When they say mild conditions, these include the asymptomatic. These are people who have the virus in their system, but they are not showing any sign of sickness. And also those people who are showing sign of sickness like sore throat, like coughing, persistent cough, but it's unproductive cough. You don't bring anything out. Is kind of cough you feel like something is stick in your throat and you want to get it out, but you can't. So these are the mild symptoms. But 57,764 are considered to be critical or seriously ill. These critical or seriously ill are mainly responsible for all the mortality, all the deaths we've seen on daily basis. Yeah, so the critically ill or seriously ill patient of COVID-19, their lungs are so damaged, so their lungs are so damaged that the lung capacity is seriously reduced. So basically, what you do for these people is you help them to breathe, with mechanical ventilators. Thank you, Fadi, welcome. Yeah, so you help them to breathe because if your lungs is in full capacity, the percentage of oxygen in the atmosphere is only 25%, 21%. The rest 70% is nitrogen, which nobody can use, and CO2. CO2 are very poisonous to us. So that small amount of oxygen in the atmosphere with full capacity lungs, no problem. But once your lungs start being damaged by this virus, the capacity goes down. So your body cannot maintain 75% partial pressure in your system. So this is where you feel really sick because if you cannot maintain 75% oxygen concentration in your blood, that means your kidneys, your heart, your brain, your vital organs will be starved of oxygen. And as soon as they start suffering starting from oxygen, they also start damaging. And this is how this virus kills people. Basically, your vital organs start what they call apoxia, less oxygen. And as that continues, they start damaging. Eventually, you end up having heart attack or liver failure or kidney failure. So these critical numbers also is on the increase, but it comprises of only 3% of the total number of people with illness. So quickly, I'll go to the top 10 affected countries who have who are severely affected, and unfortunately, these are the 10 most powerful nations in the world. Past 24 hours, US have 10,000. These codes are coming. Okay. Past 24 hours, US has 10,816 new cases, 1,149 deaths, and Spain have 3,968 new cases, 430 deaths, and Italy have 2,724 and 534 deaths. The numbers for France in past 24 hours are not yet out, but Germany have 942 um, cases, 77 deaths, and UK has 4,301 new cases past 24 hours, 828 deaths. And also, if you've been following the news, the numbers UK has been reporting are actually inaccurate. They've been reporting only new number of deaths from the hospitals, but there are a number of people dying from their homes, or in care homes where they hold old people and also people with severe mental issues. So this number, in fact, according to the National Statistics of the UK, could be underreported by 41%. So even though by today the number for UK is 17,000, but in actual fact it could be around 23 to 25,000 people. And according to their own projection, they say if they registered 20,000 dead or less, that is on the good side. But unfortunately, they are, they passed that stage now. Okay, past 24 hours, Turkey has 4,601 new cases and 119 deaths. Iran have 1,297 and 88 deaths. It looks like Iran also is over the worst days behind them. China have 11 new cases, no death. And Russia has 5,642. It looks like Russia After England, Russia will become the new epicenter. Then we go to Africa. It's the prediction Africa will peak around June, July. That's going to be terrible because this will be in the rainy season. It's not the best time to be ill. It's hot and sticky, and roads not good. So if you happen to visit a certain part of Africa that is inside, the chances of survival is severely reduced. So my advice to my fellow Africans is to stick to respect the physical distancing measures our government put in place, to help, cut the spread of this virus, because we are the less equipped, probably the rest of the world, and maybe it's easier to withstand the onslaught of this virus. Okay, that's equal. So Belgium have 973 cases past 24 hours, 170 dead. Brazil have 71 new cases and 1 dead. And Canada have 1,376 new cases and 141 dead. So I always record the countries that surrounds Gambia, but today I forgot to record those numbers. But I try to scroll down and read them to you. These are the countries that are very, very close to us, and their numbers are increasing. And we all know all is not well in Gambia, so I don't even trust their numbers. But Ivory Coast have 600 Ivory Coast have 879 cases so far, and Guinea-Conakry have 688. And past 24 hours alone, Guinea registered 66 new cases. 2 days ago, I mentioned this on my timeline that ECOWAS need to look at Guinea very, very carefully, because the way their numbers are increasing, they are posing serious threat to rest of West Africa. Because if you know the medical facilities in Guinea are not only small. And in Burkina Faso, they have so far 581 new cases. And Senegal have 412 cases. And past 24 hours, Senegal have 35 new cases. This one need highlighting. We are surrounded by Senegal in three sides, except the oceans, and even in the ocean. So, because what is happening now, which these fish mills are being operated in Gunjur, Sanyang, and Katong, is encouraging Senegalese fishermen to come into Gambia to sell their daily catch. And I also have from impeachable sources that actually Senegalese have been flooding into Gambia through our fish landing sites. So this is posing a lot of serious threat to the Gambia, and I hope the Ministry of Health will prevail on Fisheries Ministry to reverse their decision to allow these Chinese fishing factories to close. If not, why not? I'm calling on the locals, to disrupt these people working, because it's a sound life they are endangering by continuing to operate. If our immigration department is telling us, well, they don't have vehicles, they don't have the mobility, they don't have the capacity to travel around the country, and even if they do, they don't have PPEs, to effect any arrest. For example, it happened about 2 weeks ago in Gunyo, when you have these Senegalese fishermen turn up, and they wanted to quarantine them. They refused, it's resulted into commotion, but they can be arrested because the immigration officers who were deceased, were not protected themselves. So this is something the Ministry of Health, with their limited capacity and also lack of resources. So the wise thing to do is to close these fish meal factories and save the population, from explosion of COVID-19. 35 new cases in Senegal, just past 24 hours. That is really, really serious. I hope Gambia is taking notes. Even countries who actually have it very, very late, like Guinea-Bissau, their numbers are going up. So if I look at those, so I see, wow, something is not working in Gambia, like Guinea-Bissau have 90 now. So this takes me to my main topic today, which is the lockdown and domestic violence. Um, there is an increasing concern from the world over that there is sudden increase in domestic violence involving women mainly, also children. Okay, so violence against women remains a major threat to global public health and women's health during emergencies. Yeah, emergencies like these, women's suffer a lot because, as you know, kids are not going to school. They have to look after them. They have to cook. They have to put up with men who are, denied from their, daily emotional escape, like sports, like going to their attire groups and socialize. So all these are risk factors involved in it. Okay, but globally, 1 in 3 women worldwide has experienced physical or sexual violence by an intimate partner or sexual violence by any perpetrator in their lifetimes. And most of these is intimate partner violence, like it's mainly husbands and wives or boyfriend and girlfriends. So, times like this when people are restricted to their homes, is the dangers, actually increases. So violent against women tend to increase during every type of emergencies, including epidemics and pandemics. And mainly older women and women with disabilities are likely to have additional risks and needs. And also women who are displaced like the refugees, and also women living in conflict affected areas like Syria, like part of Africa, and also in Yemen now. So data is scarce right now, but we have come across this report from China that the United Kingdoms, United States, and other countries suggested an increase in domestic violence cases since this outbreak, COVID-19 outbreak, started. In fact, there is a particular province in Jinghu in China, in Hubei province. This is where Wuhan is not far from Wuhan. The number of domestic violence registered, in February 2020, that's a couple of months ago, compared to the same period last year, actually tripled. Say there is a 75% increase in domestic violence in February this year compared to the February 2029. This year is actually a study, it's a published study, which was carried out in Zizu province. So why I bring this up? Human beings are all the same. We come from different cultural backgrounds, different skin tones, and all that, but emotionally and all that, we are all the same. So if this is happening in one province in China, we expect similar things to be happening in Gambia, UK, as is the US. So it's a particular concern, and after I will discuss about the escapes that we can implement and also to remind our healthcare sector that it's not only the virus that we are dealing with, but we are dealing with something also very, very serious. And the health impacts of violence, particularly intimate partner domestic violence on women and their children, are significant. Example, violence against women can result in injuries or serious physical, mental, and sexual reproductive problems, including sexual transmitted disease, the HIV, and also unplanned preventive pregnancies. So now I'm going to discuss how COVID-19 exacerbate these conditions. Since the advent of these pandemics, how there is an increase in violence against women. What is responsible is actually the stress. For example, there is a serious, significant disruption of our social protective networks. For example, men, mainly have to go to work. After work, some will drop by in their respective social gathering groups, to socialize with their friends. And by the time they come home and eat and go to bed, the time is very, very small. But now in certain part of the world, like where I am now, is 24 hours, 24/7 actually covered. So you tend to spend a lot of time together, and in that the stress level develops. So once people are stressed, most of their behaviors are mainly irrational, bad-tempered, and also unpredictable. So as distancing measures are put in place and people are encouraged to stay at home, the risk of intimate partner violence is likely to increase. For example, I'm going to give you an example that's likely to increase. The likelihood that women in an abusive relationship and their children will be exposed to violence dramatically increase. As family members spend more time in close contact and family cope with additional stress and potential economic or job losses. Well, that's what Avatar was explaining as you know these physical distancing measures are put in place. People have nowhere to go. So it happened that women who in abusive relationship or violent relationship normally take a lot of respite when the man has to go out to work or to go and socialize. So that social escape route now is closed. That means they have to spend more time with these abusive partners. Also people will lose their job. We've seen unemployment rose to like 22 million in America. You know, and also in the UK and Europe, and also even in the Gambia, we have seen the hotel sector significantly disrupted. So a lot of people lose their job. So people who lose their job, they don't, the routine, the regular routine of getting up or going to work and come back, make you less stressful. But now you don't have to work and you are thinking of, how to keep your family food on the table for your family. These are stressful. So as I said, if people are stressed, they tend to act irrationally and sometimes are very violent. So this is what COVID-19 exacerbates risk of violence against women. And also women have less contact with family and friends who may provide support and protection from violence. Sometimes women in violent or abusive relationship, take chances to go and meet family for counseling and all that. And also, if there is no restriction measures, like no physical distancing measures, they can also go out and go to visit families and friends. This will get them away from an abusive partner. But all those escape are cut now. So that means women in abusive or violent relationship, have no choice but to see to spend more and more time with these violent partners. And also, women bear the brunt of increased care work during this pandemic. For example, school closures further exacerbate this burden and place more stress on them. Women also, women beings, as school closed, kids will be around, and women mainly, communities are the caregivers, and so the presence of kids also continuously, put a lot of stress on women as well. And also, if they stress, also they are also bad tempered, and this can make them more and more vulnerable to abusive or a violent partner. Okay. The disruption of livelihood and ability to earn a living, including for women, many of whom are informal wage workers, will decrease access to basic needs and services, increasing stress on families with the potential to exacerbate conflicts and violence. And as resources become scarcer, women may be at greater risk for experiencing economic abuse. Yeah, and women, are normally very, very industrious, even though most of them, especially in our settings, work in the informal sector of the economy, but their role in household cannot be underestimated. So even like this, if man happen to lose his job, but the woman still can go to market and sell her stuff. They tend to suffer from economic abuse as well. Man will want them to have access to their little earning they're earning, and this can bring a lot of conflicts. Um, Perpetrators of abuse may use the system due to COVID-19 to exercise power and control over their partners and to further reduce access to services, health, and psychosocial support from both formal and informal networks. Like I said, women in abusive or violent relationships, can, if there is no restrictive measures, if people are not confined to their homes, they can always find a solution. They can also go find help from family members or friends, or even in the formal sector, there are helplines they can call, to seek support. But if they are forced to be in the same house with their abusive partners, it might not be easy to do. So this makes situation very, very difficult to find a cure. And perpetrators also may restrict access to necessary items such as homes and sanitizers and sanitizers. And perpetrators may exert control by spreading misinformation about diseases and stigmatized partners. These abuse are not only physical. For example, a violent partner, like things, events like this pandemic where everybody needs soap and hand sanitizers. But there might be events, yeah, there might be occasions when these women are even denied access to soap and also so I need to confirm this. Yeah, yeah. So might be denied to have access to soap and hand sanitizers. In that way, their life will be even more endangered. And there might even be an occasion whereby the partner might try to spread misinformation about the woman being abused so that they cannot go out just to stigmatize them. For example, the partner might come up with false story that, well, she might be infected and she is coughing unnecessary and all that. So access to vital sexual and reproductive health service, including for women subject to violence, will likely become more limited. So in this time also, other services such as hotline, crisis centers, shelters, legal aid, protection service will also be scaled back, further reducing access to few sources of help that women in abusive relationships may have, because most employment right now reduce their number of staffs, you know, just to reduce the chances of people catching these illness at their work. So staff in many, even in the hospital, staff numbers are being half or even are quartered so that our interruptions cannot our interruptions are reduced to reduce chances of transferring diseases. So services like hotlines that might be there to help these abusive women, might also be struggling, either even if they have full capacity, but because the number of abuse is increased to such an extent that they are also coping, to cope with the number of volume of calls they are getting. So all these make the situation very difficult. But how health system have an important role in ensuring that services for women who have been experiencing violence remain accessible during the COVID-19 outbreak. Yes, the health sector, even though all our preoccupation is about stopping the virus and also treating the ill, but what we cannot ignore is this sizable number of women who are going under serious abuse. In fact, there's these statistic numbers are out by this charity in England called Counting Numbers, which is a charity for the number of women killed in abusive relationship. They registered 26 death. 26 women and children killed between 26 of March and 13th of April. That is, that's a nasty statistic. So the issue of domestic abuse is something we should take very, very seriously, even though in our communities in Africa, this is something that is seriously underreported. In fact, it's almost normalized, which is very unfortunate. So we have to start talking about these issues to make sure that these are also serious health issues that need the attention of our healthcare providers. Although COVID-19 has placed an immense burden on the health system and health workers in caring for the sick, there are things that can help mitigate the impact of violence on women and children during this time. All stakeholders involved in the COVID-19 response need to raise awareness of the potential effects that physical distancing, stay at home, and other measures are likely to have on women who are subject to violence and children. So I will call on people distributing these handouts to disadvantaged families, should also put this part of their agenda to educate the communities about the issue of domestic violence, and also introduce them to helplines and also charities and groups that are involved in looking after these vulnerable section of our community, that's children and women, to introduce them to it. Health workers also, the majority of whom are women in many settings, may be at risk of violence in their homes or in the workplace. The latter is a serious problem that may be exacerbated when health systems are under stress. Women, we cannot deny most of the nurses and doctors are women. So pandemics like this, you have this illness. It also have a psychological component to it that can make the patients more aggressive towards healthcare workers. So women's in front line of these COVID-19 pandemics, tend to suffer, disproportionately more than through violence or through violence abuse from the patients, even verbal abuse. So health managers or facility administration need to have plan to address the safety of their health workers, and frontline provider dealing with COVID-19 might experience stigmatization, isolation, and being socially ostracized. For example, if the man, if the wife of a woman work as a nurse, some of these women might be calling through terrible times because you go home, your husband, in fact, is not even have the confidence to come closer to you, or see my, might be over um, sensitive to what you do. They might think that you are bringing illness to the home, but you cannot actually leave this, or this is what you have to go to make sure that the family is supported. But at the same time, you are being abused, either verbally or psychologically, because you are in the front line of providing healthcare for COVID-19 sufferers. So this is another area women are going through, and they need support, collective support. Um, Provision for psychosocial support, non-performance-based incentive, additional transport allowances, and childcare also be planned. If I've seen this old man in England last time I checked, I think he raised about 30 million pounds for NHS. But NHS, National Health Service of England, supposed to be fully funded by the taxpayers. So I think this kind of money should be used to provide, psychosocial support for the frontline workers, women especially, boost their transport allowances, and also give them childcare support, because as we know, any community, doesn't matter in the West or in Africa, women tend to bear the brunt of childcare support. So the money like that should actually be hand out this out to women to help them cope with what they are going through. What can be done to address violence against women during the COVID-19 response? So, although the COVID-19 pandemic has played an immense burden on health system, including frontline workers, there are things that can help mitigate the effect of violence on women and children. Yes, there are serious strain on health care system across the world, but that should not stop us, from reaching out, to section of the women who have been going through domestic violence. Government and police makers may include essential service to address violence against women in preparedness and response plan for COVID-19. Fund them and identify ways to make them accessible in the context of physical distancing measures. What do you do? If you know your co-worker, you happen to be the manager of woman who is in an abusive relationship or violent relationship according to you, you should listen to them, and also if need be, to find them, avenues where they can constantly find support. But we cannot just abandon them like that while they are in the front line, or even not in the front line, but at home and having to deal with these abusive partners. And health facility also should identify and provide information about services available locally, example hotlines, shelters, rape cases, centers counseling, and for survivors, including opening hours, contact details, and whether service can be offered remotely or else referral linkages. So all healthcare providers, especially Africa and especially, we tend to ignore this, or even if they are there, nobody cares that much. But in these trying times, in the event of this pandemic, where people are forced to stay, together, for a prolonged time, these put a lot of stress on all partners, but women and children especially. So health facilities, what can they do to help? They should be able to identify, they should be able to provide information, to these women who are in abusive or violent relationships. For example, they should, make it available to them these hotlines, the helplines you can call to lay your problem to them, and they can provide you with counseling. And also, there should be a provision for shelter. For example, if these women or children in abusive or violent relationships, went to a stage that the couples cannot stay together, the healthcare facility, the healthcare provider should be able to find shelter for these victims, and they should be able to provide them with rape crisis centers and counseling. And for survivors also, they should be able to give them the opening hours of these hotlines, or shelters, and contact details, and whether service can be offered remotely and establish referral linkages. Okay, health provider also need to be aware of the kids and health consequences of violence against women. We can't ignore this. As I say, in Africa, these kind of issues are seriously underplayed or underreported or considered. But the risk to health, the risk so the health consequences of domestic violence to women and children is something every community should take very carefully. Our communities also is no exceptions. So they can help. How can we do this? We can help women who disclose by offering first-line support and medical treatments. And first-line support include listening emphatically and without judgment, inquiring about needs and concerns, validating survivors' experience and their feelings, enhancing their safety, and also connecting survivors to support services. The use of mHealth and telemedicine in safety addressing violence against men must urgently be explored. When woman or children or a child come to you and said, well, I've been, verbally or physically abused at home, we should listen. We should listen attentively. You cannot be doing something and allow this particular lady or child, narrate their ordeal to you. You should pay particular attention to them and listen to them, attentively. And also, we cannot be judgmental. For example, somebody starts narrating and you start blaming them immediately. That's not going to help. That can only make their situation worse. And it might even stop them from reporting. So basically, if somebody, anyhow, it doesn't matter it's a child or whatever, but if somebody should come and tell you, well, my partner is abusing me physically or verbally, you should give it all the attention, they need. Don't be judgmental, don't start out saying that maybe it's your fault, maybe if you do this, this will not happen. No, that's not the issue. You listen to them and also try to help them find solutions. The helplines, whatever you can do, will go a long way to solve the situation. But if you start blaming them or be judgmental, you can push them back, to their abusers. And as I said, in abusive relationship, if it is not addressed, life are lost. Like the numbers, the statistic I just gave you about England from 26th of um, 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 March to 13th of April, 26 women or children were killed in abusive homes. Okay, humanitarian response organizations need to include services for men subjected to violence and their children in their COVID-19 response plans and gather data on reported cases of violence against women. Yeah, we've seen the likes of Isafal, Yunus Hydra, going around, and also many communities, even my own community, we are putting something together to go and help the underprivileged. But that help we are providing, we plan to provide, should also have other components like need to include services for women, subjected to violence and their children in our COVID-19 response plans. And the Gambia government also, they cannot be sharing all these millions between themselves. They should know that once men are stopped from going to watch their football, going and sit in their attire booths, there is going to be stress. And if men lose their job, they're going to be stressed. And so we should be seriously thinking about what can we do to make sure that we identify these vulnerable women and children who are in abusive homes or having to live longer time with a violent or partner. And also, community members should be made aware of the increases of violence against women during this pandemic and the need to keep in touch and support women subject to violence and to have information about where help for survivors is available. And it is important to ensure that it is safe to connect with women when the abuser is present in the home. That's good. So at our community level, we are going very good at solving our domestic problem locally at our community levels. We normally employ the service of our imams, community leaders, and also we use employ the benefit of our joking relationship, like certain surname, like certain family name have a joking relationship with other families, and these can all be used. You know, these can all be used to help solve these domestic violence during these trying times. And this is best done when the abuser, in fact, is present. For example, if somebody should come to you and report that the husband is abusing them, or the kids should come to you and say the dad is abusing them, you go and try and see the parent or that particular man in the presence of the abuse and try to solve this. That's the best solution. But sometimes the situation is so tense, this is not possible. But this is the best way to go about it. And also, women who are experiencing violence may find it helpful to reach out to supportive family, friends, seek support from hotline, or seek out local services of survivors. And they also find it useful to have safety plan in case the violence escalates. These include having a neighbor-friend relative or shelter identified to go to, so they need to leave the house immediately for safety. Yeah, we've seen this in our communities when, for example, if women should marry from one community to another or from one village to another, normally the parents of that lady will go to a compound and seek adopted parent for that particular woman. So this is done in the event that there is a violence, in the house so that the woman can run quickly to that adopted family in that particular village. But also in our community, even women is not supposed to be married in the same community, but there should be a first line of escape. Like if violence should erupt, where you should go quickly to escape from this violent partner. So this is in our community. These are informal way of doing things, but they work very, very well. They are very effective. So what I'm going to say, if you are in a violent relationship, don't pretend it's normal. This is not normal. Nobody should be abused in your marital home. Nobody. So if you feel that you've been abused, you should seek help. You don't, sit there and say, okay, all is normal. No, you don't do that. That's not something you should do. So you should find support and also try to find escape routes. So that's bring me to the end of this program. I will summarize quickly in Mandinka, and inshallah tomorrow we have the World Art Day, and we have big guest tomorrow. Dr. Malanding JJ, the advisor to the Minister of Environment, is coming. Umar Sao, he's a Gunduru national with a master's degree in environmental studies, and also Famara Drani, another master's degree holder in the US, and a keen and avid environmentalist. And we have the award-winning Omar Malmo also, who is also joining us tomorrow. So please, even though we are in a pandemic, but tomorrow is World's Art Day, and tomorrow is the 50th version. At the end of the day, we are where we are today because of abuse of environment. For example, um, this virus originated from a bat. So that means the interface between us and the wildlife is reducing, is being damaged, and that put us more risk, to more and more pandemic. But anyone coming for quickly, well, I'm being Nadia Moke and well, pandemic or Mimba, and in feeding on so on. Yeah, duniya dawda ne report jibe violent fenko ni so ke tora so kono adin biddo kafuta bakel ni wato kono in fact a study do ke in China in Zhejiang provinces wo fan do ube jele ya itandi ko minan February karo kono fidino min ke da so kono mi anon ka tilin tam so la fata kono kono sinya tan woro lani lu yo Angleterre fanan e statistical min tambi kabo March karo tilim wani woro kana April karo tili tan min saba yo muso min dino min fami la nyo ka ta fe mo wani woro so wom fennati mi alon ka tambi ko problem o sotono and any media outlet yala ko domestic violence su kono fidino abe lafa kan yo mine o siandi wolo mi yendi ko yes suwol kono filimo ka gantino wadi bari niyajiɓe ɗum moɓe kara dow hola min kewol ta ta dow hola dow ɓiye muso tan na katu so kon jumala ta karanmo walla dow ɓiye muso ɗin keɓe kata dow hola dindigol e ta karanmoto walla e ta bamban laya so wato mi ka soto ño ka bika siya so kon clever sign mol sita ño kan dol fotela dow hola ni fotela dow hola fayniyo kuya so ni mol niyoɓe kuyarin fameda ko kenake courant ji ka tinna ila mañagol abika ke maña dimine alon ko min kolbe ba nyama abika fenke so e la faro ke fitino la sol kon to zugono fitino do man normal bar minno ka badaji ka to min sulta min dinno so mine keno min COVID-19 be keri nyana na respond plan bankoli plan wol min ke pour ka nin courant min kele anen de taralo wo kono isi min musol min dinno ma ko min ya alon ko be sol le kono fitino be siaren dani major because I even suggested that the Gambia sign alhamdulillah Gambian wole ifamos wandi ka kodol lanyo kan ka fundi kata ka mo man ko mini halon ke bulo mi ko be yo bari lo mani tala kono la tulu tala kono min fen ko yanda kudo fanan la fara ji mi alon ko ka mol ka jandi fitino la min be sul ko min fitino be kiri yanda min la kila Ni members will be able to afford the mini along quick municipal market well within his own members or the kadina ani also folwana miɓe pengo kono fuɗo kono bungo kono mi yalan ko fiɗi ɗum ɗiɗi kana siya ka yeeɗi matoyro yiɗa yeta keñina teroriya walla ala wulwulal o fen ko heɓi ko to biɗa komin to nato ɗiɗi kono ɓe ñami ye makoyro ni bar kana siya ka because aman normal because nin hadama dimo bisodaɗa fa kota ɗon parce que kuku kenoɗo komin mañi report o min fo momi yalan ko mi homin fata min ɗimi so for local for the half open in England, but that from 1 year was here at the battle. You one near the domestic violence and Tola community can come Gambia Benyani. Minimum cool that more title for a miracle is normal, it's part of life, but I'm not to put me uncle Yanta Kella. And the Nata Dam going Yanta stop land. So I'm from Yanta Kato Kella, in Fero land in saying stop Monyadi. Ya Allah barakanda da mu kala bulu al say video means say plus if there are so many other okay was men the environment war update Allah barakanda.
Beyond 1,000 reasons why. And you can't be perfect, baby, 'cause nobody's perfect, darling. But no, 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 there's nobody in the world like you. What do you do when you can't let go? What do you say when you just don't know how you feel? You are worth beyond 1,000 reasons why. And you can't be perfect, baby, 'cause nobody